Hi, my name's Jordan Leahy, and this is Ron. So we're focused more on the patient education awareness and consumer side. So our project is Heart Health or HeartRan. So we are developing a AR health platform to deliver patient education and focus on medication adherence. Our target market would primarily be the elderly and also the youth. So some of the big problems around medication adherence is just the complexity, the forgetting, and just the overall experience, and traditional apps are not as engaging anymore. And they're just really complex. They're burdensome, you have to do a lot of data entry, and they're just different. So we want to take advantage of new and emerging technologies. So specifically as a regular consumer, a rare disease, a heart disease, that's really complex stuff. And I'm not really good at going into medical books and understanding. So what I would like to see is something interactive, something different, that can give me some awareness and help me understand why I should be taking a medication. So we just want to do something different. And we're going to take why AR is really good right now. It's 3D, it's accessible, you don't need hardware, big, expensive VR devices, and we can do really cool games and animation. So we're going to focus on education, gamified, and real-time self-awareness. This is just an image. This is kind of how the gamification would work, and then the self-awareness. And now we're going to jump to the demo. Yeah, how do we switch? How do we switch to this? Oh, there we go. Okay.
Hi everyone, I'm Dan. I will show the demo. So here's the app. As a patient, say I'm a patient, cardiac patient. I just got this pill bottle from my doctor. I made this one called beta blocker, real simple to showcase this. I really don't understand why this medicine can help to improve my heart. So by opening my camera, I scan the pill bottle. By reading the text here, I will show you real quick. The text is just like this. So by recognize the text here, it says beta blocker. From my screen, I will see this bird.
You have to swipe over your screen.
Okay. So the bird is actually saying, I don't know why the voice didn't come up, but it's saying, let me show you how beta blockers work. It's like a doctor, virtual doctor here. So I click on my button, how beta blockers work. I will see the heart here. It's the open heart. So by step-by-step education module, I can go through all the education content. Then I will understand why this beta blocker can help to improve my heart. So once I got it, I can check my messages. This comes to my second feature, which is about medication management. So each time I check my medicine, I will see a virtual bottle here, which says eat me with lunch. So at this point, I will know I have to eat this medicine. As you can see, there's a cute puppy trying to engage with the patient. So I say, I have taken this, so I got a virtual flower. This is the virtual encouragement for me to help me to change my behavior to take medicine on time. So the next message is...
I think we're going to have to stop there, but terrific. That's really been nice.
Thank you.
Go to the heart one. Just listen. Questions?
Oh.
Taiwan.
So you talk about, audiences, audiences of both children and the elderly. So those are obviously pretty different populations, both in terms of technology sophistication and just the content that they can consume. So can you talk a little bit about how you plan to succeed at engaging both, as you said you would?
So I think when it comes down to like a business model, how you're going to get this into the hands of the users, you really look at a payer strategy, medication adherence, as well as a large health system that's maybe has like some type of capitation model. They're really focused, and I have a background in healthcare technology. I work a lot in the city, and a lot of traditional apps, they're just too much. So I think from like an elderly population, a lot of the baby boomers who would be going into this market, they're all smartphone savvy for the most part. I envision my grandma, if she got into it, husband's passed away, she's growing her virtual garden as she sits and watches like Wheel of Fortune, you know, that type of stuff. And then for young kids, we see how do you take their mind off the clinical experience, the hospital experience. I think this is something that's really different. And the AR market in general is just growing dramatically. This time last year, there's like 7 million downloads globally. Right now, it's running up to about 30 million global downloads in this space. So a lot of inspiration from the gaming center. Any other questions? Cool.
How much is this going to cost
How much would it cost for the user?
for the user?
Yeah, I mean, the users won't pay for healthcare applications. That's a fact. It's always going to be a benefit. It's going to be a self-insured employer route. It's going to be a payer strategy. So it would be a per person per month type of strategy.
Thank you.